about a category of diseases. I know many of you might have heard of them, but you actually do not know under what category they fall. We've heard of non-communicable diseases. Have you heard of what they call neglected tropical diseases? I guess it sounds very new to many of you, and you're like, what are they talking about? But today you're going to learn what they are. Now, this comprises of several category of diseases that might come with severe pain, and later sometimes the severe pain might turn into what we call disabilities if not well taken care of. But also, not only that, today Uganda celebrates World Neglected Tropical Diseases Day. I know we might be hearing about it, like we said, for the first time, and you're like, what is this day? We are more used to diseases that we know traditionally, like malaria. But here with me in studio to take us through this topic of discussion, I have two wonderful gentlemen. Gentlemen, good evening. I'll ask them to introduce themselves. I'll start right with you.
Good evening, viewers. I'm Dr. Alfred Mobanjizi. I work with the Ministry of Health. I'm the Acting Assistant Commissioner, Vector-borne and Neglected Tropical Diseases.
Okay.
And the head of the Neglected Disease Division.
All right.
Yeah.
Yes, please.
And I'm Dr. Narcis Kabaterene. I work in an NGO called Ascend, supported by UK government.
Okay. Now, thank you so much for your time, because we don't take it for granted. Everybody would possibly prefer to stay at home, but the mere fact that you have opted to come to UBC and to educate us about this topic, we cannot take it for granted, and as well as get the country to celebrate with you. Now, when we talk about the why, it's very strange, because all diseases naturally get attention. When I'm feeling unwell, I'll naturally run to a clinic. Now, why do we call this particular category of diseases the neglected tropical diseases?
These neglected tropical diseases are diverse tropical infections that normally affect low-income population in tropical countries like in Africa, in Asia, and America. These include diseases like trachoma, like schistosomiasis or bilharzia. We have onchocerciasis, or what we call liver blindness. We have sleeping sickness. We have nodding syndrome. We have also added the snake bite. We have diseases like jiggers. There are many, and there are actually about 20 diseases. I cannot talk about all of them. And these diseases, they normally leave their victims with permanent disability, like blind. Some of them become blind. Like if you get diseases like trachoma, of course, schistosomiasis. You have seen people with schistosomiasis. They have also permanent disability. We have people with elephantiasis. You have seen them with disfigured legs.
Yes.
So we think now that we should come together and we stand with them. Of course, they leave them with the discrimination and the stigma. And on this day, this is the day actually since last year, 30th January. That's when we started globally start celebrating this day.
Now, you've talked about those diseases, and what I find quite strange, then some of them cut across, because when you talk about permanent disability, let's say like blindness, why is it there are other diseases that would also cause blindness? Why is it that trachoma is separated off the other diseases and put into this category of the neglected tropical diseases?
Why they are called neglected tropical diseases? At first, they were not given enough attention. They are not given enough attention, and actually they are affecting many people, and they have left many people disabled with permanent disability. So until 2012, January 30th, that's when we had what we call London Declaration that brought all partners together across the sector, countries and communities affected by designated tropical disease to push for greater investment and action against NTD. So this day actually is a anniversary of Rwandan Declaration, where we bring the health advocates, the political leaders, the policy makers to push for greater investment and action against NTD.
Okay. Yes. Now I'll get to you, Doctor. Is it due to lack of resources or treatment options? Because I would imagine the mere fact that it's a disease, it draws much attention that you need immediate attention. But if it's neglected and goes to an extent of leading to permanent disability, is it due to lack of resources? I would like to ask you.
Yeah, these diseases, it is not necessarily lack of resources, but as Dr. Mubanjis told you, they affect very many people, numerous, and requires lots of money to reach these people. For example, trachoma, which we are talking of, I think over 12 million people are affected. Intestinal worms are part of those NTDs. Everybody is at risk of intestinal worms. Would you reach everyone? But you can treat everyone using the communities and so on, and all health workers. And you know, to treat everybody, it costs loads and loads of money. So that huge amount of money is really what is lacking. That huge amounts of drugs at the same time is what is normally a problem. And if we had them before, then maybe we would have done a great deal, because as we shall be talking, we have achieved a lot.
Let's get into an example of malaria. Malaria seems to be cutting across everywhere and is heavily funded. Why isn't this happening for this? Because yes, it's in, I would assume, since you say it's a tropical, it's in a fewer areas and not covering the whole of the country. So why is it that it's not?
I think why malaria has attracted a lot of attention, it has what we call high case fatality rate. In other words, if it attacks you, you are likely to die. Unlike NTDs, they rarely kill, but they live with permanent disability. So attention originally was put to those diseases that kill people first. Diseases like malaria, like HIV, like TB, they attracted a lot of attention. That's why there is money even from Global Fund and other partners. But these ones, neglected tropical diseases, they affect many people. Although most of them, they are from, as I said, low-income population. And if they did not have maybe many people to advocate for them, but in tropical region in Africa, actually in the first we had many cases. But the Uganda Ministry of Health, we support from partners. Partners, I want to thank partners like RTI, Act End East Program, Ascend Project, where is the country director, funded by DFID. We have got Kata Center, we have Site Savers, we have World Vision. They have really supported us and they have made progress. Actually, I'm happy to mention that most of these diseases, we have eliminated them, or they are at the pre-elimination phase, or we have at least interrupted the transmission. They are no longer public health importance. However, as I said, they have left most of the victims with permanent disability. So we are actually doing what we call mobility management. Yes. For example, they helped us. We had the guinea worm here in Uganda, which was eradicated. And we got a certificate in 2009 with support of Kata Center and other partners. And now we have eliminated lymphatic filariasis or elephantiasis, which has been there. We have also interrupted transmission for trachoma. You can see. We have also eliminated onchocerciasis or liver blindness. It also leaves people also blind. However, we still have a challenge of bilharzia, because bilharzia you get it from these water bodies. and almost 90 districts in this country that are endemic for bilharzia. And also we still have soil transmitted hemolysis, these are worms, and also viral, visceral leishmaniasis. This is Kalaza, which is in Kalamoja. It is very fatal, it kills, but we also, with support of DNDI, we are also controlling. So we also stand with the rest of the world. Of course, to commemorate this day, where especially it brings all the partners across to advocate for greater investment and action against NTD.
Okay.
Yes.
Now I'd like to get to you, Doctor, because now I believe of all of them, there must be one of those, which is extremely outstandingly common, and one which has left a lot of permanent damage. I'll give an example. I guess Uganda didn't have nodding head disease until a particular time when it was like a storm, and it hit hard. I'd beg for you to respond to that. Are there any of all of them that you've mentioned, one that is very particular, that in your strategy, when you say you're getting out to try and see how to counter it, this is where you think you can be able to reverse some of the damage that has been done?
Yeah, these diseases are virtually very important, all of them, in one way or another, because their morbidity, which they cause, is different, but all of it really causing a lot of damage to the economies, to agriculture generally, and really we lose a lot, and we do not develop just because of these intestinal worms. These worms. As I said earlier, intestinal worms are the commonest, but
worms in Uganda are the commonest.
Yeah, the hookworms, they make people stunted, and these large worms, the scaries, they cause death through blockage of the intestines, and people die, and you wouldn't know how many they have died. Bilharzia is very common. It is in some areas along Lake Albert, Pakwach. It is killing very heavily. But because I remember one time I went there, and I wanted to see the people who are most affected, who have vomited blood. You vomit blood, and in the process you may vomit too much and you die. And we went on the radio and we announced that those ones who have ever vomited blood, please report to the nearest health facility in Pakwach. There were too many, and we never repeated it. And in the end, we just established ourselves in about one sub-county, and we got over 500 people severely affected, and whom our health systems at present have very little to do, because they have gone beyond. So these diseases are all important. Leishmaniasis in Kalamoja, it is killing silently, but you die. They take long, but you eventually, you are not productive in life during the productive period. Maybe they affect your mental capacity, so you do not go far. And maybe once you are retarded in school and so on, your productivity also is in a way affected. They make you weak. If you are a fisherman and you cannot go to the lake and fish like other men overnight, what will do what? So all of them are vital. I don't know how I can think of one particular one. I think all of them are bad.
Now,
add on what he has said. He talked about nodding syndrome. Most of these nectar-topic diseases actually are transmitted by either vector. Of course, they are caused by either bacteria, a virus, or protozoa, but all transmitted by the what? By the vectors. That's why we call the division vector control. And he talked about the nodding syndrome. Actually, the vector that causes onchocerciasis, liver blindness, the same vector that causes nodding syndrome. And these are the black flies. Northern Uganda has got so many rivers, and these black flies, they live in fast running river. So to control nodding syndrome, actually we had to now to control the density. We had to control the black flies. So once you control those black flies, then you have now controlled nodding syndrome, you have controlled onchocerciasis. And we did that by doing these interventions like spraying, air spraying, river dosing. So when we kill those black flies, that's why we don't have new cases of nodding syndrome in northern Uganda. Since 2015, there are no new cases.
What other success have you got to report in some of those? Because what I find, there is a time when the eastern region, you remember the time we had the jiggers, and it was extreme. So what are some of the things, because I would imagine then it won't be called neglected, because by the time you're able to counter it and you've been able to have a solution, so like say you said nodding syndrome, that we don't have other new cases, but we have other people who are suffering, who had permanent damage or permanent disabilities due to it. So what have you got to say about that?
Of course, once we identify a disease, like you have talked about jiggers, we use public health interventions. Like you have talked about jiggers. Jiggers is basically about hygiene and sanitation. So when the jiggers were big issues and the place everywhere, we moved in. And we found actually the issue about hygiene and sanitation. You found most of these people, some of them were sleeping in the same house with goats. So it's about sensitizing the community to improve their sanitation, not sleep with animals. To some of them, when you go to Karamoja, there's this open defecation. So we have sensitized them at least to have latrines. So once you identify a problem, then you see where to intervene. And most of these are public health interventions. Sometimes people, they don't know. So we have sensitized them to improve on their hygiene, to smear their houses. And that's how we have eliminated jiggers in Busoga and Karamoja. It's still a big problem in Karamoja because of open defecation, but we are still talking to them, and we are sure that in the future they will also change. Yes, but in Busoga we have at least controlled jiggers.
Now, Doctor, I'd like to get to you. What plans do you have in place to see that this, because if these diseases need that much attention, to see that they're not overshadowed by the others, because the non-communicable diseases seem to have taken on the high. Not in a good way, but it's like it is a lifestyle disease per se, and it's something that everybody is fully sensitized about, as opposed to these particular diseases.
Today is one of the methods. We are doing this hoping that the authorities, both political and civic, can see us and think around and think that these diseases really should be controlled. And it is the duty of the government, and the budget line should also be increased. Actually, in our advocacy, we have been also reaching out to parliamentarians in the health section, those ones in charge. And actually we have an NTD champion, and we selected the parliamentarian. And our aim is, if those topics about neglected tropical diseases can come up, and the government helps to mobilize funds towards controlling these diseases, they do not kill immediately, but we are losing lots of money. The economy could be improved greatly if your people were healthy. The NTDs are affecting millions and millions of these people.
Actually, again, another intervention that we have used. As I said, NTDs, we are using interventions like diseases which are controlled by mass drug administration. And that's how we have also controlled the nodding syndrome by now giving tablets to all the people at risk in that region. Because these black flies, they have now injected the worms, Ocosaca valvulus, people's blood. So these drugs, we give them once in a year, that clears, the drugs clear the worms in the blood, from the blood. So we also, the same method we are using, trachoma. All those people in endemic regions, we have been giving them drugs. We give, I think, once in a year, sometimes twice. At first, when the disease was very serious, we could give twice a year, but now we give once. And all these drugs are donations from donors abroad. So you can imagine once they stop. So we call upon, of course, the government to support us, because these drugs are very, it's called mass drug administration. Diseases like elephantiasis, that what you have seen on the screen, that is elephantiasis. We do mass drug administration. The whole population at risk, they must take those drugs, whether you want or you don't want. And that's how we have cleared those worms in their blood. The steel trachoma, also we give the mass drug administration, and also onchocerciasis. So, and all these drugs, they are donations, they are very expensive. So you can imagine once the donors stop. And we know most leaders did not know that actually this disease exists. And now we call upon the policymakers, the political leaders, supposed to sustain what we have gained.
Okay.
Otherwise, if they don't support us, then and the donors stop funding us and giving us those drugs, we shall go back where I've come from.
Now that is a little bit worrying, because it it comes into the issue of sustainability.
Yes, that's
because
what
you have started something that is successful.
Yes.
But now there is the issue of sustainability to ensure it doesn't happen again.
It's true.
Like the strategy being used for the mosquito nets.
Yes.
Every 3 years, then they will give.
Yes.
Now, what is your plan and strategy? Because I'm made to understand you have a beautiful plan.
Yes.
In terms of the control program for the sustainability plan.
Yes.
2020 to 2025.
Yes.
What is it like?
Yeah, the sustainability plan is vital, and he has explained why. Most of the money we use to distribute the drugs, to pay the health workers, to pay a token of money to drug distributors because we can't reach everywhere, to pay teachers, and to transport these people are all donated, as he has said, and this cannot go on forever. And there is a threat that at any one time we might be found alone with our diseases. So sustainability plan actually is the major important thing we are going to do on the NTD day, to launch it. And we are launching it with the high political representation and civic representation, and the main aim of the sustainability plan launch is to ensure that there is ownership. And the way we are going to do it, one of the ways we are going to do to increase ownership is advocacy. But advocacy alone through this talk, through these papers is not adequate. We want to make sure that during the period we ensure that although this is a campaign, we integrate the activities in the health system so that the health workers will be aware of the disease in their catchment, they will be aware of the drugs they need, will be aware of the need to treat those people. And when they come, they will be aware of how to manage them, and they will report through the health system to the district level. One time I went to Pakwach and I was looking at, I asked them, I was looking at the list of the most important diseases, and unfortunately Bilharzia was not mentioned, just because in the health system there is not much. It has been done as a campaign to eliminate the disease, but we find if it is not sustained, these diseases, he said, we had interrupted transmission, can come up. So when you report through the health system, then there will be demand from the health workers themselves in the health center when they are ordering for drugs. Or when they are there, they will say, oh, we do not have Plasquantium, we do not have this disease has come back, and they will start ordering themselves. They will, in the end, because of that demand, we feel that they will create ownership, they will maybe improve on the funding to them, to the drug, to the diseases. So in the sustainability plan, we are mainly building the ownership. We should own our problem. We should be able to sustain it. We should be able to manage the disease and ask for support whenever we have problems, support from the government, And that's the major approach, and it is what we are going to launch.
I would still like to dig further on what does the plan entail, because that's the key area you have talked about in terms of ownership, but there must be those particular nitty-gritties that you would like a person watching you right now to know that yes, you're with them.
Yeah, first of all, we want to ensure that NTDs are taken like another diseases by the health system itself, and all people who are managing the health system, they know that they are their diseases. They should be able to know how to plan to manage them. Once a person reports in the health facility, should be able to diagnose. They should be able to know how it is transmitted. So we shall endeavor to train the health workers, and they should at the same time be able to make sure that all other people who are affected are informed about these diseases. So we need to inform the communities, the politicians, to know that this is a problem in their catchment. So once we do that, we feel that we have to equip the health, of course the health facilities, they will ensure that they equip them with the necessary equipment. They will ensure that they train the personnel who should manage these diseases. They will ensure that the reporting system is through any other disease, so that reaches the minister, like malaria is reaching there. And in that way, we feel that we shall be managing to instill sustainability.
Actually, as he has said, for us, we did not celebrate our NTD Day on 30th because of other competing activities. So we have been doing, of course, other activities. You saw us fumigating bed bugs. We have done other display activities for World NTD Day. So we are celebrating our day on 4th,
okay,
which is Thursday after tomorrow. And on that day, the major activity is launching our sustainability plan. This sustainability plan, I think in Uganda, is the first in the whole of Africa, and I think not in the whole world, because even other countries have been consulting us how we have done it. We have worked with partners, inspired by RTI. We have worked with other partners, especially RTI, Ascend Project, Site Savers, Kata Center, World Vision. We have all worked together. And now said we have seen this division, actually these programs have been dependent, donor dependent. And now you have seen what COVID-19 has done. COVID-19 pandemic has done the whole world. So we thought these donors who have been giving us funds and these drugs and what, now they may not now give us more funds because of the COVID-19 pandemic. So we said, what do we do? And we sat down, we developed our sustainability plan, which are going to launch on that day. And of course, talks what he has talked about. Mainstreaming, because what we have been doing in PDs was like they were left to partners that have been doing their things, and the health workers would, the health facilities would say, that's for the other project, this is for the other project, and has been more of the mass campaign. But now we are saying mainstreaming. So that when the patient is in Kalamoja, you should also go to health facility and get treatment from there. Of course, before we do that, the capacity building. Train health workers so that they manage those diseases. Because some of them, they really don't know how to manage them. Yes. So, of course, increase the funding. As you do all those things, at first they were not budgeted for. Now we are saying the government should put up more money for NTDs. Yes, collaboration and strengthening collaboration and partnership. As you have seen, there are many partners who are working with us, but some partners have been doing their own things, and sometimes they are here, they do a lot of work, and the data is not reported, and So we are saying now, let's now, of course, strengthen our collaboration and the partnership. So all those things are in our what? And our sustainability plan. And of course, all of it has gone it at the government ownership. The government should now own this program. So that it is also given a priority like malaria, HIV, and TB.
Yes.
Because as we have said, these diseases, they leave permanent disability. And when people are, of course, they are disabled, they cannot produce. Of course, it also affects the production, and eventually, of course, also affects the economy. Because if they cannot dig, they cannot do what, so the also economy will be affected. And now we are saying government ownership, especially with this now COVID-19 pandemic. We are going to see these donors cutting the support they have been giving countries, so we need to prepare. We need to prepare, and we don't want to go back. We don't want to see now getting a new case of nodding syndrome. We want now to keep those black flies permanently eliminated. We don't want to get new black flies which will also transmit what? Nodding syndrome.
And I wanted to add on the integration. We want to involve everybody, the community themselves.
Yes.
The people of WASH, these people who do sanitation, they do water, they do what, we want to bring them together. If we have latrines and everyone uses those latrines, then there is no bilharzia. If we have good water and we are washing our face, there is no trachoma. And we're washing our faces comfortable and so on, we have that. We want to bring them on board. We want to bring on board even people in agriculture. For example, if you are in a paddy rice field, but you are occasionally taking care of the snails, controlling them, or an irrigation scheme, and we have made sure water to run and so on, the snails will not multiply there. So there will be little or no transmission of it. So you need that agriculture person. The fisheries person, majority of the people who are dying are fishing people. They should be aware of this and they should be involved. You should know that during drug distribution, these people, maybe some of them fish at the net and so on. So the fishing community can involve them as drug distributors, treating some of those people who are very far from the areas. But above all, they can also struggle to ensure that their learning sites are clean, they have latrines and they are taking care of them. So in other words, schools, for example, they have to be involved. So in the sustainability plan, it is not only the health workers, we want to involve everyone.
You did mention about COVID-19 and its effects. How bad has it had an impact, say, on those low-income communities that have been affected by these, conditions and possibly have permanent disabilities? Have you tried to track and do a follow-up? Or say, given that now we are worried of the donors, due to COVID-19, withdrawing a little bit of the funds and resources, which is most likely going to happen in terms of the medicines that you've said. Have we, besides the sustainability plan, have we already mapped out and seen evidence of this happening in some of these low-income communities?
Yes, of course, COVID-19 also affected NTD like other programs. Because as I said that we normally have this mass drug administration where we administer drugs to all the population at risk. And we use it to, of course, distribute these drugs through schools, and now the schools were closed, so even drug distributors, on that time when there was total lockdown, these people could not move. So we had actually now to postpone the schedule when we used to give these drugs. So it affected us. However, we have tried to observe also peace to make sure that these people get their drugs in time. But it has definitely affected us. It has affected us. But we have tried to observe also peace by sensitizing the communities, and they should observe also peace. COVID-19 is with us. So when we go for example, for training, we make sure that they observe also peace, like social distancing, they wash their hands, they wear masks. but we hope that once we don't know when this pandemic will be controlled, but we have already felt the impact, of course.
Oh dear.
Yeah.
Oh wow. Okay, now as we get down to on Thursday,
Yes.
to launch this sustainability plan and to really like celebrate, of course, the successes.
Yes.
What theme have you tagged to the activity or to the celebration? And
The
possibly
theme is
why?
Yes. The theme is there. It is, we don't even the width. The whole world is celebrating that day. The theme is there. It is the beat and the neglect, and NNTD for good and for all. That's the theme.
Okay,
Yeah.
so we have gone with the international theme. We didn't do a selecting of our own theme as a country, because sometimes
Yes.
I've noticed for some of these events when we have the international theme,
Yes.
then we also end up having the local theme.
It is, we are with the international community, but in short, to make it clear, we are saying that let's end neglect, and then the entities will be eliminated.
Okay,
Yeah.
at least that is good to know. Now, from your experience, then in your plan still, what solution do you have for those who've got permanent disability? Because now remember, they have hampered productivity, like you said.
Yeah.
And of course, the worry is also, we hope we don't end up getting others, you know, getting affected with the fact that the program has been disorganized due to COVID-19.
Okay. Already, as I said, where we have interrupted transmission, we have got so many victims who are being left disabled. Already, we have so many people who are blind in the Soga region here, in Karamoja, in West Nile, Nebi, and we have been doing surgeries, trachoma surgeries. We have been doing trachoma surgeries, and the good news is that when we operate them, they actually they are able to see again. We have, as I said, this lymphatic filariasis, elephantiasis. They leave them with, you saw them with that's the lymphedema, the swelling of the legs. So some of them, they get the wounds. So that's what we have been doing. That's the surgery for trachoma surgeries. We are already doing surgeries there. So most of these people who have got the swollen legs, that's the lymphedema. Sometimes they get also wounds, secondary infection. We have been helping them to, of course, reduce the edema, the swelling, and also treat the infection. Some of them have got fluids in the scrotum, what we call hydrocele. So we have been doing surgery. We do surgery, hydrosectomy, because you find someone has like testicles, the scrotum is weighing about 5 kilograms. So you can imagine such a person walking with the scrotum weighing 5 kilograms. So we have most of those people, and we have been doing surgery to reduce the fluid which is accumulating in the scrotum. So we have not left them behind. Definitely we continue doing rehabilitation, treating now the complication. That's why we are saying we have sustained what they have achieved. Otherwise, if we say now we have eliminated these diseases, we know most of those we have eliminated, those who are affected, they have been left permanently disabled, and we have to continue supporting them. Yes.
I get to asking, because I'd like to ask for the team, the technical team, to play for us a success story after operation. But before they play the success story after operation, how do you manage to convince these people? Because here in Kampala alone, we ourselves are scared of some of these things. You tell somebody, even if it's not trachoma, it's an eye condition, that they have to undergo surgery, the first thing they say is, this one is going to make me blind permanently. And they're like, no, once the eye is touched, that's a very delicate part. How easy is this to convince them?
Yeah, as you said, other than just working on those surgeries, you can see on that picture, the people who are doing it are Ugandans. And they are everywhere. What we have done, in addition to what he's saying, we have trained our local teams everywhere in every district. We have equipped them. You can see how they are, that those equipments are bought. and we have given them surgery kits, surgery what, and that means the people now, everywhere where the disease is, in every district, the health workers are now trained, the health workers are now equipped, and that means even if someone refuses, because sometimes, as we have said, you can say, I remember one of the ladies who refused her daughter to go. She said, you have come at a wrong time, and the daughter was almost getting blind. We could have corrected it. She said, you have come at the wrong time, and it is Christmas, my daughter is the one who cooks, so I cannot accept. And such a person, in future, if such a person, we register those people, we take their telephones, and we leave them with these people. We have given equipment, and we have trained.
Okay.
And these people are ophthalmologists attached to districts. Then they are supposed now to take this in, you know, they were put there to take care of the eye, but they did not know how to take care of the eye caused by trachoma. You can imagine. Maybe they are taking care of an eye caused by other infections, but not the NTDs. They were as neglected as that.
Oh dear.
Yeah.
Okay, at this particular point, I'd like us to take a look at one of the success stories, because trust me, success has come out of some of these surgeries, and it can be corrected, whatever the condition might be.
Obusa bwokulongosya okusumitire bakulongosya
nkali kubona mu buzibu
byetutaka ebyo kuti watairewo obuvumo okuba nti noibawo bamulongosye
kunimwe
oba oyine busobo oba waba oyine muniwe bwasinzireko koba oibawo oti zena bwe bakutererya maiso muzeeyo owulira otya mudi
ate notende kuwulira ku bibi kubanga obuvuba be bunsumbuwa nga timoga ayata nomoga ku era negaterera naba ndi kusa wabula kutulako lino nini zwamaliga kyonka
kuwaira bulezi byona walitenga ku
nayo kali kumawali yani kali kumpa kale nije gityo tukola nomoga naira ndo tumoga
okisa
nikyekyo basawo era tubeyanja ino mwebale yeteyange gavumenti ekulembera omujingo so Museveni niye gibituukira kuwumeka sinatuta iso tubaye naye tumanya so tulema kumwebalyo president etuma buwangazi akalu kake bakitwala gondi era njegano omunga ekinano mukaga nisosookera okubiriza abantu okubairya abamu ndebutalo luwiri okubiriza abantu nebakumbania kyali kizibu nino ndi bwana okubokya mulero si okumagumu ku bantu ngotalo luwiri so tuli pamu
Very Kaguta Museveni is doing well to support them to get this program.
Tuwebalya ino tubula president agondi ekitole suna kubanza obukulu bwange ndabyeko bapensi bangi naye no wanjawulo enfuga ye ayambanya abantu bawansi kale ye muntu omulungi asana okulembera eggwanga.
So you've really had him, and of course you can imagine at that age, there are certain times if nothing or no intervention had been put in place, he would definitely, him and the wife, become permanently blind.
Yes.
Yes.
He would become permanently blind, and that man, he had actually become blind, and he had left his job, and he has 3 wives. He was no longer taking care of them. He was just walking almost on a stick, and he's celebrating because he's saying the president has even remembered me, a poor person. That's why he's saying the vote is for the president. He should remember even the poorest person like me. Now I have my life. Now I was tired of debts. Now I can pay my debts because now I'm gone back to my work.
Wow, that is nice.
And as you said before, you can see the house. We see these are diseases that normally affect people, the low income earners.
The low income earners, very
Yes,
true.
so these poor people, most of them are actually affected. They are there in the community suffering, but the government did not know.
Oh dear.
Yes, so people don't take it as a big serious problem, but I can tell you that many people and the community, they are suffering.
Okay.
Yes,
And
so I want to thank
you can,
the partners who have worked with the Ministry of Health to help these people in the community.
Just
Yeah.
between August and January, we operated about 1,800 people.
Wow, from trachoma.
Yeah, for that trachoma.
Wow.
And we are ready to any minute. In this February, we are going to start again and go on the road. We have trained many of those doctors, as I said, and we are equipping them. The good thing, we are also bringing the equipments, and they can even continue doing it. But at any one time, when we go to a campaign, we just add on vehicles, extra doctors. It is being done by the locals whom we have trained.
So as I said,
that's sustainability.
in the past, actually, we had about 43 districts were endemic with trachoma. But the support of RTI and our SAID, site savers, we have eliminated trachoma in most of those districts, apart from 3. We only have now Moroto, Brisa, and Nebi.
Why apart
Yes.
from those 3? Because if you have success to tell in some of the other districts,
Yes.
why are you still struggling with these other 3 districts?
And those 3, actually, one of them, Moroto, is the only one where they had not eliminated. I tell you, RTI Envision did a great job. It eliminated the disease in all the districts except Moroto. But reinfections have occurred.
Okay.
And they occur because of that poor sanitation. I remember I talked about that we have to bring on board even people with water. We have to bring on board latrine use. We have to bring on board health education issues. And they got reinfected. And what I think RTI might be doing, other than treating, it is also giving health education messages and also joining these other people to talk up to them to ensure that there is some improvement on those in those areas. And actually, what another area which we have been supporting, we have been supporting now to bring the WASH people and the MTD people, his team, to work together, plan together. So an area like RTI had eliminated the disease in Nebi, it had eliminated the disease in Brisa. Why should it be there now? It is now that it is there, and we know the problem. Then the WASH people could come together with us, with them, and as these ones treat, the RTI people treat, and with the Ministry of Health, of course, everything is done by Ministry of Health, supported by RTI. As they treat, then the WASH people are also working on water supply, and the people are working on ensuring that people have latrines, and that way reinfection will be
Managed.
it will be managed, and we shall in the end eliminate the diseases.
Okay.
That's what of course, most of these patients are from hard-to-reach areas where they have limited access to clean water. A good example is Moroto. But I think now is increased coverage of access to clean water. That's why he's talking about WASH. The WASH we are working with partners who are brought on board the WASH projects. And we hope that once they get clean water, maybe it will also help us to eliminate the trachoma in those 3 districts.
Okay.
Because the same strategy has worked in other districts where we have eliminated.
Okay.
So we are trying to talk to the other 3 districts to borrow relief from the other districts. Of course, now bring on board also the other partners, WASH projects. Once they access clean water, definitely we shall also make trachoma in those areas.
Okay.
Yes.
So in just a few seconds from each one of you, I would like you to share with the viewer your winding up remarks. I would like to start with you to share your winding up remarks to the person watching you right now.
My winding remarks is that the NTDs are real. They have affected our people. They have, of course, affected our economy. So I call upon all the stakeholders. We work together and we meet NTDs once and for all.
With me in particular, you know, this NTD Day is going to be celebrated in Kampala. Sometimes we celebrate most other diseases in the communities, the affected communities. We particularly chose to do it in Kampala because we want to reach those people who have the power to change things. The authorities in the Ministry of Health, the authorities who are working on sanitation and working on wash, we want actually to ensure, many want to bring this message to them that we should really end the neglect of these diseases, and we budget for them. We cannot keep thinking that these are just diseases which will be supported by partners, because partners will never stay with us for long. So let's own the diseases, let's support and budget for the diseases so that we eliminate them, and as he has said, our economies will boost up.
Okay. Thank you so much, doctors, for your wonderful time and for educating us about the NTDs, but we're hoping that the next time it will be a breakdown of disease per disease, so that we are able to get more information about them. Thank you so much for being a wonderful viewer. It's just like 4 minutes to the top of the hour. The 10 o'clock bulletin will be coming your way shortly. Thank you so much, and have a good night from me and the team of doctors here in studio.
Thank you.
Okay.